I think we are live. So I think YouTube did upgrade, so I don't have to click on anything anymore, so which is good. All right. Good afternoon, everyone. Sorry we were not able to be with you last week. Today is June 4th, Friday, 2021. This is United Medical ACO weekly event. And my name is Kemal Erkan. I'm the chairman of United Medical ACO. As usual, we have some similar updates, some updates from our similar items, prior items, and then we have a couple of guests. But today's highlighted guest is going to be the CEO of YWCA Delaware, Stephanie Stats, who's going to be with us, and in the next 10 minutes she'll be joining us. But I'm going to ask Tanner to join me, and then we can start giving you the COVID-19 update, and after that we'll be with YWCA. All right, Tanner, you are on.
All right, thank you very much, Kemal. So as Kemal mentioned, we're going to start off with some of our regular updates, particularly taking a look at the rate of vaccination, starting here locally in the state of Delaware. So as we can see up here, Delaware is just over 50% now of its population has been vaccinated. You can see that on that top line is what is being shown here on our path to 75% or that herd immunity. So being just over 50%, we keep an eye on how that's affecting the 7-day rolling average of new positive cases as well. And we're seeing a continued decline in that. So where is the United States actually in the rate of vaccination as well? So we've actually dipped under the 1 million doses per day mark for the first time, really since I want to say back in February. You can kind of see that shown on the right side here with our trend graph as well. So that is just keeps pushing out at the rate of which we are vaccinating when we will be able to get to the 75% covered for population of the country as a whole. We're looking at about the 6-month mark at the current rate of our vaccination. So with that being said, we're taking a look at then on the country as a whole, with the amount of the population that is vaccinated, where are we looking at with new cases on that 7-day rolling average or new cases per million here. So the United States just behind Delaware when it comes to percent of population that is vaccinated, means Delaware is slightly ahead of the national average here, being that we do have a little over 50% of the population in the state. The United States coming in at about 46% here, but that has also current efforts and what we have accomplished so far continue to knock down the rolling average for new cases on
so,
the country level.
Tanner, I think our concern is when the numbers on a daily basis, it was over 3 million. We were going to be done in the 3 months. That was 2 months ago. Now that number drastically dropped, and that's something that we want to highlight. So if you are still not vaccinated, please make sure that you reach out to your state health department or your primary care physicians to get the vaccination, because the only way that we are able to go through this if everyone is able to get their vaccination completed.
Certainly.
So Tanner, my mouse here is a little bit faster than me, so in case I skip
no worries
those slides,
just no worries at all. So we did want to get into some other updates, news updates, particularly that we are seeing coming out regarding some of the vaccines, some of the other COVID updates that we have. Firstly, with the Moderna vaccine. So a few, I guess a month or two ago at this point, what we had talked about was, I believe last month, the approval of the Pfizer vaccine for use in our adolescent population. So next up would be the Moderna vaccine. They have been going through some clinical trials in that same population, that 12 to 17-year-old population, since early February, possibly late January. And we're starting to see some of the results from those studies now. And that's showing that they have been highly effective in that adolescent population as well. So important to note that this has not been approved for emergency use for this population as the Pfizer vaccine has. That is still currently the only one being used for our pediatric population. But this Moderna vaccine, the Moderna does plan to apply for that emergency use by the FDA sometime late this month, hopefully. So we could see that as another vaccine being used to help inoculate against the virus. So here we just have a little graphic of some of our providers, our pediatricians.
These are our Cerner doctors from UMACO clinic, right?
Correct, yes. So something else I wanted to touch on was a new article, some new information coming out regarding the immunity to COVID and how long that's actually going to last for, or how long people will we need booster shots for our vaccines after it's initially done, who's going to need booster shots, maybe how often. It was all something that was still kind of up in the air as we do continue to inoculate against the virus. And as time goes on, this is all stuff that we're still continuing to learn. So something that we're starting to find out now is that the immunity cells, or your what's going to help you be immune against the virus, particularly in those people that actually did contract the virus at one point, they are going to have some of these cells able to survive in the bone marrow. So if you did have COVID at one point and then eventually got vaccinated, this study is suggesting that the antibodies are going to persist for years to come. So whereas
in the kind of like practical way, I was infected in April 2020 with my COVID. Like, this is a real life story. So January 2021, I got my first vaccine, and March, I believe, early March was the second one. So the chances of me getting reinfected versus someone who's just with 2 doses is a lot less.
Right, and that's what essentially this study is starting to suggest as well. So, and additionally, you're much less likely to need a booster down the road, right? Whereas if someone such as myself who hadn't gotten the virus but did have received both vaccines, there's a much more likely chance that I'm going to need to receive a booster shot. So this is still, of course, as I mentioned, as we learn more throughout the process of the vaccination, we'll find out. But it seems like that's going to be the case.
So before we go to the next slide, so I just want everyone to remember what I did say about Dr. Anthony Fauci and some comments that I made regarding his age and job, his being so extremely demanding. I hope I'm on the right slide, by the way. Yep, I am. So
it might be a little delayed for me.
You didn't see it?
Not yet.
Huh. So right now you don't see the Dr. Fauci slide?
I do not, no. Now I do, yeah.
Okay.
We're on the same page.
So this is interesting because all the emails that he has received between March and April 2020 is being published. And he gets thousands of emails every day. And I think he was kind of behind with reading them, or he needed other people to help him, which we expect that. But it's a very demanding job, and we didn't read everything yet. And I don't know if there's any new reports out, but someone at his age and what this job requires, I think there's a really big disconnect. Demand is extremely high, and I wish that they didn't put him in this situation. But next week or so, we will be getting into those emails and then see if there was something that could be helpful if we were to react to this problem earlier. So I don't know if you wanted to add anything.
Sure. Well, I didn't get to read through many in particular. I did get to read through this article. And certainly, I think some of the interesting points that I took from it were just the sheer volume that he was receiving on a day-to-day basis, really coming from, as he mentioned, colleagues, all types of different institutes, academics, and then even just he mentions the amount of random people just reaching out and trying to get a hold of him. So I think the more we are able to go in will certainly be interesting as we get to learn a little bit from that perspective, particularly his from what you mentioned was such a demanding job at a very hectic and chaotic time early on in the onset of the pandemic. So I think that insight is going to be pretty crucial to not just understanding our situation, but then also being able to prepare, as he mentions early in one of his emails. He talks about one of the questions he received was what was keeping him up at night from the early on, and it was talking about the possibility of respiratory or some sort of pandemic such as that we had obviously are now still going through. So
yeah, he wasn't maybe taking enough Ambien.
The situation is a large, a big learning experience. So yeah, it'd be interesting to get some more of those.
Thank you for the COVID-19 updates. And
sure.
Now, you and I, we prep for these sessions, and other than the COVID-related items, that's how it started. But then we added United Medical ACO patient-based issues that we could actually discuss in this setting. And also just to kind of increase that variety, we added other guest speakers from the state officials to some other organizations. They were our guests. And today actually is, I'm going to ask Stephanie Stans to join me. She's one of my favorite people in Delaware, at least. So Stephanie, you are on mute. If you can just unmute. Oh, all right. How are you doing?
I'm doing well, but I'm a little hurt because I thought I was one of your favorite people, period, not just in Delaware.
How about East Coast? We can make it East Coast.
Okay, East Coast. Okay.
You are one of my favorite people. So it's not limited by the geography. So, but thank you so much for joining us today. So I just want to kind of give a little background on how we decided on this. Recently, there was an article from our marketing team. They focus on the YWCA and what I do with you guys. And from that, we said, well, why don't we invite Stephanie to our live session, and then we can actually discuss what you guys do and how else we can help, like different people, how they can get involved. So there are different things that we are going to discuss, and anything that you would like to share with our audience. But this is almost 10 years now, right? You and I, we first met, and that was through Eileen Donnelly. And I was extremely happy from that time to the time that we are today, and what we were able to do with you and with your organization. So I have a couple slides on our PowerPoint, but if you can please introduce yourself and what you do with YWCA, and then we'll go through a couple of the questions.
Thank you. Thank you so much. And thank you for giving me the opportunity to spend some time with you today in this forum, and, to help hopefully to, raise some awareness, not only of what we do at YWCA and how important community support is for our work, but also to acknowledge the amazing support that we have received from you personally, Kemal, and from the entire United Medical team, which has really done so much to advance our mission, in particular for our families who reside at our homeless shelter in Wilmington. So if you're not familiar with YWCA Delaware, as Kemal introduced me, I'm the CEO. This will be my 6th year as CEO, but I've been with YWCA for 15 years or so now. The years just keep racking up. And one of the reasons that I've stayed with YWCA as long as I have is because it has really provided me an opportunity for personal growth, both in my professional skill building, but also in my personal growth as far as understanding really the depth and the intricacies of the issues that affect our clients in the space of eliminating racism and empowering women. So that's our mission. And we work toward achieving our mission by concentrating in 4 different programmatic areas. It's housing, health and safety, economic empowerment, and racial and social justice. And our housing work has been a particular interest of Kemal and the United Medical team. They've been very generous in supporting our clients directly in the wraparound services that we provide in addition to shelter. And I'm happy to go into more detail about what we do at Home Life Management Center and how we do it, but I'll pause and I'll let you guide me, Kemal, and where we should go next in our conversation.
Sure. I think one of the most important for me was looking for the charity in different ways. Like sometimes when we do this, is it meaningful? Is it really impacting the society that we live in? And is it efficient? And what separated the YWCA, for me at least, from any others is the approach that you guys have. And that approach is looking into the current situation and then trying to help these families and then trying to get them back to their life again and improve their lives. So it's almost like from permanent to temporary setting, which gives them some foundation for the future. If you can elaborate that a little bit, that would be helpful.
Sure, thank you. So at Home Life Management Center, we comprise really an entire city block in West Center City. And what we provide there is emergency and transitional housing for families. Along with the housing, which is literally the roof over your head, we provide a lot of support services. And the goal of our goal for the families that we serve is that we're not, simply providing shelter. While that is absolutely a basic need and a fundamental right, we also understand that in order for a family to be able to live independently, to support themselves, support their children, and really reach their own economic and individual goals, that oftentimes we need to really dive in deep and understand the root causes of their homelessness and help them work through the impact of past trauma, of past incidents, and get strong in those regards, practice life skills, practice parenting skills. All those things need to be part of their journey and their time at Home Life. So when they leave our program, that they're going to be successful on their own. And so every family that comes to us is literally homeless. So they are coming to us on an emergency basis. And so our priorities over the first week really is to make sure that food, clothing, shelter, childcare, school connections, all those things are met very promptly, that our families feel safe and secure, that they know that they're safe and secure with us. And then we start to build a relationship between our case managers and the families. We start to build that relationship of trust and kind of shared purpose in their success, of shared interest, being vested in their success, and work on developing an action plan with a client that most often includes the support services that I mentioned earlier in economic empowerment, in health and safety. We're very intentional at YWCA in what programs we offer and where we offer them. And we find that our economic empowerment and health and safety support services provide the best wraparound for our clients as they're receiving housing. Some of our families only need this kind of emergency period to transition back into independent living. But for some of our families, their needs and their journey is a lot more intense to have them be able to live successfully on their own. For those families, we offer transitional housing. And that is a model that really provides kind of incremental steps to living on your own, kind of phasing in, paying a portion of your income towards a room fee, paying for your groceries, making sure that you're preparing your own meals every day, while at the same time, you're still living on site at Home Life. And we are there if you take a couple steps back, sometimes if you fall, we're still going to be there to help lift you back up. So there's still this great safety net around our families. They can stay in transitional housing for up to 24 months. Most of our families don't. Most of our families need anywhere between like 13 to 18 months before they're ready to move on their own, but they can stay up to 24.
So you used the term, I said temporary, and then you corrected me, I believe, with the transitional housing. So for those who may not know the difference, so if it's a homeless shelter, that's permanent, right?
So there's different types of housing interventions for the homeless population. And so one housing model is permanent supportive housing, and that's really designed to, that's designed for, I guess, highest need individuals who really, for a variety of reasons, are never going to be able to successfully live on their own. So these are structures where, oftentimes it's an individual that, there's not even an intention necessarily of working with them with a goal to live on their own. There is an acknowledgement that they were always going to need some support. And so permanent supportive housing provides that. That's not what we do at YW. At YWCA, we're working with the segment of the homeless population where it is an emergency need, meaning they need at most up to 60 days of shelter to be able to get back on their feet. It's not uncommon that those families, because we do concentrate working with families as opposed to just individuals, it's not uncommon that families that need just a short stay, so say 3 weeks, in an emergency shelter, that's due to one particular incident that has caused their homelessness. And so we can work to help get them back on their feet after that. It could be a loss of income, it could be overwhelming debt. In some cases, it could be eviction. And so another intervention that's available is called rapid rehousing. And that is essentially sort of like rent support, temporary rent support, to help a family go from emergency shelter into living outside of the shelter in the community, but they still need a little bit of help for a couple months to help kind of get them on their way. So their need for support services and case management is often a little bit lower than someone who needs to stay in shelter for an extended period of time. So you weren't incorrect, Kemal, when you said it's temporary. It is all temporary. We use a transitional model to best illustrate what we're doing, which is, while this is temporary, it is a transition between emergency shelter and living on your own, because we understand that your needs are best met when you have a lower barrier access and a more regular connection to support services. So that can be, for example, the program, Kemal, that you and your team designed and launched for us several years ago for individuals who a barrier to their independence is having sufficient earned income to support themselves and their family. And they needed computer skills. They needed training and direction to move into, in our case, in that partnership, it was to help them qualify and be competitive for office positions or front desk positions in medical offices. And
so this is the program that we with United Medical Leadership we built. It was back in 12, 13, 14 timeframe, I want to say. Susan Anderson was leading that. And I think hopefully we are going to maybe do something similar with that. We did hire people from that program. After the training was done, we hired at least 2 or 3 people, if I'm not mistaken.
Yeah, that's fantastic. And, the ripple effects of those 2 or 3 people are enormous because, you know, those individuals, if they came from our program, which they did, it means that they have families, it means that they have children. And so, you know, what these kind of programs can do is they can really break cycles, multi-generational cycles within families, whether it's poverty, homelessness, um, you know, and need for external support. That's what these kind of programs can accomplish. And that's what we're about at YWCA. It's about empowerment. It's about, you know, with us, with our partners like United Medical, it's providing, you know, it's understanding what families need, what their barriers are to being able to, frankly, live their best life and their most fulfilling life, understanding what those barriers are and making sure that we're providing the support that they need, whether it's programs or services, to be able to overcome those barriers.
So, Stephanie, I know people can actually get involved in different ways. If we can maybe go over those, how can we help? How can we get involved?
Well, thank you. This is a great illustration of some ways that you can help. Our website is ywcade.org. We are constantly freshening that with upcoming events, with upcoming current volunteer opportunities. So you can go there anytime and get an up-to-the-minute snapshot of how you can get connected to us. An easy way to always stay abreast of what we offer is to follow us on social media. You know, we do the, you know, the big 3, if you will, Facebook, Instagram, and Twitter are the primary platforms that we use. And, you know, we post regularly and you will see opportunities to get connected through those platforms as well. So certainly we are always in need of donations, of contributions from individuals. We do receive grants. We do have some contracts with government entities. It's not enough. I mean, it really covers the bare minimum. And so in order to really be able to do what we do and achieve the outcomes that we can, we need support from people like you who help us fill in those gaps. So certainly through individual donation, save the date, October 13th at 8 a.m. is our annual celebration breakfast. And if you go on our website, if you join our mailing list, we'll be sure that you get an invitation, an early invitation before it goes out to a broader list, so you can get the best seat. So it's a wonderful, wonderful event.
So
you get volunteer opportunities as well.
So this is, I'm just gonna share the website. So in case, I know everyone should already know, but so this is our website, right?
Let's see. So that is YWUSA. So we
okay,
are.
And so here I am.
Okay. There we go. Okay. There we are. So you see, we have a Fresh at YW. We just had a panel discussion last week that's still on there that we, you know, post. That's one thing from going through COVID and lockdown periods is we very quickly transitioned to delivering services and programs virtually. And so now it's become a habit, even as we open up and we can start to do more in person. We do record our programs that are open to the public and make the link available. So you can check them out at any time.
So you mentioned the grants available, and I do remember several years ago we had some issues with how those being actually allocated to the different shelter programs. And because we do the transitional housing, it was almost like if we weren't included in the shelters. There was something that I remember, and I know that issue was resolved, but are you guys, or are we getting the enough support from the federal and the state governments?
So I wouldn't call the issue resolved necessarily, but we are in a slightly more secure place than we were. The circumstances you referred to were a shift in priorities of funding to support emergency shelter somewhat, but to more to put more support behind permanent supportive housing, to put more support behind rapid rehousing, which is that program that's essentially like rental assistance for a few months, and to take away from transitional housing. And so the population that created the most threat for were families, especially single moms, and especially families where there was a history of domestic violence. Those are some of the top reasons that cause women's homelessness. And it follows that the families that we work with in our transitional housing program, these are issues that they face and have to work through. And so the shift in federal priorities to support more community-based housing, that's fine for a certain population, but it leaves a large percentage of the population out. So we had to really fight to make sure that it was clear and that everyone understood the value of transitional housing, why it was important. Kemal, you were part of making that argument with us, which is extremely helpful. And as a result, because we were really in jeopardy of losing our funding. And if we lost our funding, that particular funding stream, we would have to shut down Home Life Management Center. Without a doubt, we would have had to shut down transitional housing. So, because of all that effort and because of all that time that went into making sure that the decision makers and the influencers understood what would happen if we had to shut down transitional housing, it did help us to preserve our funding, but it's still in jeopardy. I mean, these are federal priorities on what housing models and, some of the factors that weigh into how those priorities are applied on a local level do not work to YWCA's advantage. We are still fully committed to transitional housing.
Do you think that's because of the lack of understanding, or like there must be something, right? So, and the nice thing, someone who's being outside of US, who was born and raised, I can kind of compare different systems. And I think our system here allows us to voice our opinions in a manner that we can reach out to our state officials. And I know Chris Coons, good friend, and not only he helped with this situation. Lately, there is a situation with Tigray, Ethiopia conflict, and I can see how much he wants to help. Now, but it's just one person versus there's an establishment almost where some of these organizations are there on the first in line. So then by the time it gets to YWCA or organizations like YWCA, it takes a lot of funds away from these people who really need this. I think do you think that's kind of like the understanding, or there's some other maybe underlying issue that we are not aware of?
Well, I think that, there's a variety of factors certainly that influence how priorities are set at the federal level and how funds are allocated. And I think too that, there is an ebb and flow to any social program about what is the best model. And I think that it is not uncommon when there are self-funded studies that those studies will support kind of the thesis or the thinking that you went into it. And so I think that was some of the circumstances that led to, this kind of determination that if we only had more permanent supportive housing and if we only had more rapid rehousing dollars, it would solve homelessness. So, I think that the challenge for organizations such as YW is, we don't have, full-time lobbyists. We don't have, whole departments that are there to work on communication strategies to help convey who gets left out when we kind of put all our dollars into one solution that we kind of self-funded the research on that anyway. So that's why it makes advocates for our work so important. I'll share with you too that we will be launching an advocacy network, an action network over the next couple months. And if you, sign up for our mailing list, I mean, we promise, there's options, we won't inundate you. But if you stay connected with us, you'll be the first to see how to get connected with our action network. Because we do need the support of the community to lift our voice, to lift our client voices, so they don't get left out.
When I did the first site visit back in 2012, that was a big eye-opening. Now, I mentioned Eileen Donnelly. Eileen is someone who's very special for me. Her son, John Donnelly, is one of our directors. He's in the leadership team. But every time I have different issues that's difficult to overcome, I would call her and ask her different opinions. And when we got involved with YWCA, one of the first things that we did was a site visit. And I think everyone really should be doing that, just to kind of see what you guys have done and how well organized and how efficient and how much there is need for. And for the longevity of the work that you do and the impact that it's generating, is creating for the society. I have seen so many different charities, and I would say YWCA is the best charity with the goal, with the aim, with the mission. Everything is with the right people like yourself. And I admire you guys so much that you are able to make this happen. And I think if we can make some more people aware of what's happening with YWCA, I think that's gonna help hopefully long term for all of us. So Stephanie, thank you so much. I really do appreciate you joining us. And maybe before the end of the year, we can get together again on this live session, because it does help, especially these days. We did kind of we started taking advantage of the issue with the digital media and then being able to reach out to our patients, but then we realized that we can actually reach out to everyone else. So then this was part of that. And I'm really happy that you were able to join, and hopefully we can repeat this again.
Yeah, thank you. It'd be my pleasure. And again, I appreciate the opportunity, everything that you have done for us. And I appreciate you just having brought up about what a difference it makes to come see for yourself. Because we do offer mission tours, we offer those site visits. Those are also on our website. We have started to open those up to in-person, but we also do virtual. And that really is the best way to kind of experience and see for yourself what we're about and how important it is for us to have advocates and supporters. So come on, I just can't thank you enough. I know I tell you that all the time, and I mean it every single time, what a difference you've made to the organization. And you are one of my favorite people too. And your heart is always in the right place, and you're ready to pull up your sleeves and get right in there. And we appreciate that so much.
Thank you so much. Thank you so much, Stephanie. We'll see you soon.
Okay.
All right. So thank you. And I believe Donna is going to join me now. Is Donna available?
I am here.
So before I start crying, I just wanted to. So they really do a lot of work. So I know you are also part of what we do there, and from the UMACO leadership side, and you have seen the efforts, and making it meaningful is really important. Well, Donna, Uncle, welcome to our live session. We couldn't, YouTube actually sabotaged us last week, so we couldn't go live. And it was an issue on their side, but we had this problem with the hospital numbers. Now, if people are not watching these sessions with the right mind, they may think that we are just attacking hospitals. Well, that's not the case. Our goal is to utilize the resources efficiently. And also, we want our people to know, our patients to know that this is what's happening on this side, and this is how we can improve and how we can actually save and help individuals, and also the state and the federal government, as the Medicare and Medicaid is a big part of the healthcare delivery system. So, Donna, one of the things that what makes it also sensitive with the hospital expenses, other than, well, you and I, we have a horse in the race, right? So we manage a accountable care organization and the contracts of these insurance companies. So we want to reduce the cost and we want to increase the quality and all that, right?
Absolutely.
That's so. I mean, I just want to say this. So I'm saying this just because we have a horse in the race. So we are being open now. Just put that as a side, and just try to see this from a different point. That at least what I do. I have this picture in my mind that someone, 82-year-old, a Medicare patient with no secondary insurance. And when I look at that patient and see what that patient is challenging with the healthcare expenses and how this expensive setup that we have, unnecessary utilization that we have, how it's affecting these individuals. So this is not just business. So that's what I'm trying to kind of highlight. So we do have patients, Medicare patients. I don't know if you have seen these more and more these days, but you go to like one of the pharmacies and I see someone at the cashier, as a cashier, she's like 77 years old. This is a real story. And, you know, I have to ask, like, why are you still working? And it's a part-time job. Well, because most of the time they have to pay their medical expenses. Now, you know, they may be seeing this as like, oh, well, he's dramatizing this, but is there any exaggeration in this, Donna?
Absolutely not. We try to educate our patients, our staff, as well, that a couple of things. One, patients, when they have non-urgent issues, should go to their PCP, because who knows them better? Who knows their history better? It's the PCP that they've been seeing for years versus someone in the hospital that they're going to see one time. And although they can give their history, if anything's missing there, it could be something important. And then again, to your other point, Kemal, you know, there's wait time. You know, it's important for patients to understand that we set aside a certain number of appointments every day, right, for same day, and try to prioritize those. If we can't get you in that day, maybe it's the next day, but you're not waiting. With telehealth and you're feeling sick, you don't have to go sit in an ER for 8 hours. You can see the provider from your own home.
So Donna, I think one of the things that I wanted you to kind of explain to us,
Sure.
You know, the patient behavior is so interesting, how it can be easily changed. So what we have seen during the pandemic time, the peak of the pandemic, is how low the ER utilization was. And this is United Medical's ER utilization, especially these last 5 weeks. And as soon as I see this trend, what triggered me to actually share this in this setting, because when you look at the state COVID-19 data, they show the hospitalization going down. And that is correct. There's no problem with that. But the hospitalization that's not related to COVID is increasing again. So can you explain this to us and then what we can do to fix it?
Yes. So a couple of things to keep in mind is these numbers show ER visits as well as inpatient visits. So when we drill down and look at that, one of the things that we see is, you're right, during the pandemic, patients still had a lot of the same, you know, health issues going on. They were looking at alternative ways, right? That's when we started offering telehealth, etc. So they would utilize telehealth with their own primary care, maybe they would go to an urgent care, but they weren't going to the hospital, right? Because they were looking at that as people at the hospital with COVID. They didn't want to potentially expose themselves to someone with COVID. So to your point, that behavior changed. Now what we're seeing throughout this year, and is some of it that people are getting vaccinated. They're feeling more comfortable, right? They're opening up. Some places are not requiring masks, although healthcare facilities still are, because many patients are coming in that are sick and aren't vaccinated. So we think a lot of it does have to do with their comfort level of feeling comfortable to go back to the hospital, but are they going for the right reason? And we do track avoidable ER visits, those that could be seen in a different setting. So again, what Kemal's showing here is where we see those large increases. So yes, from the middle of April to the middle of May, we've broken this down by 4 of the hospitals here in Delaware, and we see, Christiana has gone up significantly from 147 to 245. So over 100 cases, you're almost doubling what you have there as far as patients going in. We do see some increase with some of the other hospitals. In blue is Bay Health. Nanticoke is in the gray, but certainly not to the extent. We really only saw
Donna, one thing on this, because what actually what I'm worried about. So for those who are not from Delaware, they may not know. So if you were to name one of the most luxurious buildings in Delaware, normally if you were in Turkey or Europe or some other part of the world, it would be usually a hotel. One of the luxurious building is Christiana Hospital. The lobby, you go in and it's amazing, humongous. So all granite. So why I'm saying that is because I look at St. Francis, we have a similar proportion population in different parts of the state. And while people are just rushing to Christiana, they are actually not going to St. Francis. So, and then St. Francis, and I'm a big supporter of St. Francis Hospital in the last, 20 years. Unfortunately, the perception of St. Francis is, it's an outdated building, not like outdated doctors, outdated technology. They have the same doctors, they have the same technology, but when you look at the lobby of St. Francis, it's not really welcoming from the patient standpoint. And I just can't help but think about this. Like, are we really just going there to spend time? Or is there some other reason? And I'm not kidding, actually, really. So, because why are they not going to St. Francis?
Right. Yeah, because when you were showing the numbers there, you could see that our St. Francis numbers, and we do have quite a few practices, right, in downtown Wilmington. So we have a lot of patients who are in that area, and we really have not seen any increase when you look across there. Yes, there's some variations, but we don't see a spike in the last 4 weeks of, more than doubling the numbers there. They remained relatively constant. So
that's kind of like, I wanted to point this out, and I wanted our patients to kind of remember that we are available through telemedicine. We are available with our care coordinators, care managers. Hospitals are expensive places for preventive medicine. Please, unless you are in an urgent need, don't utilize hospital services. It helps you with your health, because the other thing, that hospitals are not the cleanest places. So many people do get sick because more sick people are in under one roof together.
Which is why we think it went down significantly, right, during COVID.
Right.
You know, and the point is, everyone still received good care during that period of time, right? They did receive it in the alternate places. So some of it is that perception and the behavior, though. Oh, we have to go back to this, but do we really? Because we were getting, you know, really good care other places.
So we don't have to go back. That's what one of the points that I wanted to make. Now, there was a nonprofit aspect of this today's session, but you know, when we have these discussions, sometimes we have to spend enough time to make sure that we register these issues. So today, I don't think we have enough time because we have the bariatric event starting at 1. So I'm going to actually cover the not-for-profit organizations in healthcare settings and how they are not actually not-for-profit, not most efficient. From different resources, I have some good information to share. And, you know, as we are preparing, so where's Tanner? So Tanner is always freaking out if we have enough stuff. And I always tell him, look, we have way too much. Today we couldn't even start, but I said you last night. So we'll be doing those. So at least next week is ready. So
yeah, great. We got plenty of stuff to go over now next week.
So so our events for Bariatric Friday. We need to get the copyright of Bariatric Friday, by the way, because I came up with that. So I would have the trade mark of that. Bariatric Friday will be in the next 7 minutes. Our doctors, our program director, Dr. Erkan, will be joining me. Now, I'll have 3 of our nurses today. As you can see today, I'm just spoiling myself with a lot of beautiful ladies joining me. So, but what's interesting is actually Donna's daughter, Jessica Ranko, who is one of our pre-op nurses at American Surgery Center, will be one of the nurses who is joining us. So I thought if you are watching these events and you want to kind of see the connection, that's what's happening in the next couple of minutes. Donna, thank you so much for joining us today. I know you are off next week. I'll do the case conferences. I enjoy those as well. So when you are back, hopefully all the patients will be healed and no one is going to the hospital. Tanner, thank you for helping me to put this together. And I will see you guys in the next couple of minutes. Thank you so much. Bye-bye.
Thank you.
Thank you.